Welcome to Montgomery Heart Wellness. We're having another session of clinical rounds. I'm excited about today's episode because we're going to talk about the issue of polypharmacy. Here's my friend, Dr. Bobby Price. Hey, how's it going, man?
Great. Glad to be here with you.
Likewise, welcome to Clinical Rounds. And what I want to do is I want to share the story of a patient that we started working with a while back. And she had an interesting presentation. It was a 76-year-old lady. And many aspects of her history was very common to what we see. She had a history of high blood pressure, pre-diabetes. She had lupus, systemic inflammatory condition. She had a history of a stroke, GERD, lots of problems.
Yeah.
And the one peculiar thing is that she had allergic medication list was as long as I've ever seen. There were probably 20 different medications she was allergic to. So that was one issue.
Right.
Her blood pressure wasn't well controlled. And the only medication that she could tolerate for high blood pressure was the eplerenone.
Okay.
So the two medications she took, one was eplerenone, and the other one is hyamine, and that was for GI reflux for the GERD.
Yeah.
So we saw her, brought her in, did our evaluation, and she was from out of state, so she came in for our integrative approach.
Okay.
The other part of her history that was pretty significant is that she said she had been diagnosed with hyponatremia, low sodium.
Okay.
She was also having fatigue and some brain fog.
Okay.
And she was also having some weakness.
Gotcha.
Early in her evaluation, within maybe the first, I think it's definitely within the first week, she was at the hotel taking a sponge bath. She said she suddenly became weak and fell to her head. We sent her to the emergency room. The evaluation was normal, no bleed in the brain, etc. She was there for observation. We brought her back out. But I began weaning these medications. Her sodium was low.
Yeah.
And she was having some motor issues, stiffness, weakness, fatigue. As we weaned these medications, she started getting better.
Right.
And in fact, now again, she was on the detox diet. We started some special infusions for blood pressure. So the blood pressure is better, even though we're weaning the medication. We got her off the eplerenone and off the hyamine within about a week's time. So that was back on her second week. So help me out with this patient. So, again, the long medication side effect list. Now, of course, they may not have been classic allergic reaction, but there was some kind of an adverse reaction.
It was enough.
It was enough.
Yeah.
So that's one thing that was a little bit unusual about her. And then, of course, she was on two medications. Now, you think a list of just two medications, you think, well, that's not a problem.
Right.
I mean, 5 medications, okay, maybe.
Yeah.
10, maybe. But the weaning of those two made a big difference.
Right. Without a side effect. And so we have to always keep that in mind when we're working with patients, especially when I'm looking at this patient. This patient is a very low body weight. And so this is a small patient.
Yep.
It's an elderly patient.
Yep.
So you got to understand when you're working with elderly patients who are also small, there's always a potential for them taking any medication and always having those side effects because their livers can't always process these drugs.
That's a good point. Someone in her condition likely wasn't in the study when these drugs were looked at.
Indeed. And so that long list that you're seeing an elderly patient, one, you're seeing a small patient, and then the other thing that I see that I noticed that you talked about was that she had lupus. Now, whenever I see an autoimmune condition, I instantly think gut issue.
Okay.
And the reason why I think a gut issue is because when you get a condition called leaky gut,
Yep.
what's going to happen is once the gut starts leaking, it's going to make the immune system hyperactive. And once the immune system becomes hyperactive, it starts to tag all sorts of things. And the way I always tell patients, imagine right outside of your gut where the bloodstream is, where all of the nutrients are supposed to come into. So then they can flow into every crevice of the body. Your immune system is sitting there and like a sniper.
Yes.
And it's saying anything that comes past there that's not a vitamin, a mineral, an amino acid, not a protein, an amino acid, a healthy fat, etc.
Yes.
Anything that comes across that's not that, I'm going to shoot it, I'm going to put a tag on it. And when it does that, it creates an allergy.
Yep.
You see what I'm saying? So anytime I see somebody who has an autoimmune condition, which means that Now the immune system, which is a sniper,
Yep.
that only picks off what shouldn't be there, is now targeting you. So what made the immune system go against you?
Yes.
Okay, so when I see a long list of drugs, the first thing I think is liver. The liver's probably compromised. Okay, or you can't, for some reason, you can't get these drugs to metabolize.
Yes.
But the second issue I noticed, because she has lupus, which is an autoimmune condition, I'm instantly thinking there's a leaky gut, which is also causing some autoimmune issues as well too. As it pertains to the two drugs, so the hyamine, the unfortunate thing, like I said before, there's always side effects with all drugs.
Yep.
And one of the side effects of hyamine is it lowers stomach acid. Okay, and as you can see in one of the patient's complaints is acid reflux, not able to keep down their food.
Yes.
Now, typically what people think around acid reflux is that there's too much acid, but the real issue is that it's too little acid. And what that does is it causes gas to form in the stomach that pushes against that cardiac sphincter, which opens it up, and it shouldn't be open. And as a result, when you lay down, now all of this acid is flowing back into the esophagus. Okay, that's also why the food flows back as well too.
I see.
So that could just come from simply the drug itself.
I see.
And I think that's really, really important for people to understand. Again, you took this drug for the acid reflux, but initially the acid reflux could have been caused by the fact that you're eating way too many carbs.
Yes.
And as a result of eating too many of those refined carbohydrates, you get a little reflux.
Yes.
But then she further complicated the issue by putting her on this medication that further lowers the amount of acid. Okay, so that's one issue and the other issue with hyamine that is it tends to make patients have an increase of dizziness and lightheadedness. And I think that's really important, especially when you're talking about elderly patients, because you really do have to be very careful about putting them on drugs that make them dizzy.
How about the electrolyte problem? Any issue like magnesium, sodium with any of these drugs that concern you?
With the Electrolytes,
Yes.
so that can cause hyponatremia.
Okay.
And so she had.
Yep.
And so even though she was taking it as a result of having to figure out what medication to take because there were so many she couldn't take,
Yes.
and they probably put her on the Electrolytes as a result of that,
Yes.
it probably addressed the high blood pressure issue if it did. But the unfortunate thing was that it caused the hyponatremia as well too.
Yeah.
And also one of the side effects of hyponatremia and also the medication, it also causes dizziness and lightheadedness.
Yes.
So now you got two medications on our profile that could cause dizziness and lightheadedness and also feeling weak, which could have led to her passing out in the bathroom at the end of the day.
Yeah, and those are great points. One thing I really like about your discussion, your dissertation, if you will, is that you explain how you get into the biochemistry of what's happening. Is that, okay, she has an autoimmune disease. Okay, fine. What's the label? Discoid lupus. Okay, well, that's fine. We don't care about the name. What's the process? What's the pathophysiology? And so we address it based on that. And if we're just treating high blood pressure, and we're not looking at the underlying problems that may be triggering all these things.
Right.
We just start to give you chemicals that cause other problems. And I think that was the case with her. And the interesting thing, when I spoke to her before coming, she said, if I can just get off these medications, I would feel better.
Right.
So the patient knew better. So just to wrap it up, this patient, as you would predict, we weaned off the pherenone, the hyamine. And interestingly enough, the nutritional intervention and some of the other things were effective in allowing her body to reduce inflammation, reduce what we call oxidative stress, which are toxic chemicals, achieve biochemical and physiological balance to the point where her blood pressure was better controlled without the medication. She was stronger, more energetic, and her sodium level eventually came up into the normal range.
Right.
When it had all been abnormal. And her kidney function improved too, just improved likely based on better hydration.
Right.
So this is quite interesting. Any final comments for the audience, thoughts?
One final comment, I saw that she had PAD, and I also saw that she had a little bit of occlusion both in her left and her right leg. And you know, I'm always bringing up the lymphatic system.
Ah.
And one of the responsibilities or functions of the lymphatic system is to collect excess cholesterol and triglycerides. And so sometimes what you can also see with patients is when they have poor lymphatic function or flow.
So increased toxicity in the extremities will be contributed to poor circulation.
Yeah, because you got to think, you know, we have, I honestly say everybody knows about the primary pump, the heart,
Yep.
but the lungs are a pump too.
That's right. That's
So
right.
we got two pumps
right.
up here.
That's right.
We got no pumps to pump the blood
right.
in the lower limbs.
That's right.
So whenever your body is saturated with toxicity, the place that it's going to concentrate when it's circulating in the blood is definitely going to concentrate in the lower limbs.
Yeah, that's a good point.
Yeah.
And some people ask often, you know, why do you have excess fluid and fat cells, et cetera? Because the body has to push those toxins somewhere. You push them in the interstitial space, and the lymphatics have to absorb it from there, but then they get clogged up. So, great point. So this patient, again, only 2 medications, but she was on too many.
Yep.
And by simply weaning these medications, she got better. So anyway, I hope you got a lot out of this. I certainly did. If you have any questions or comments, please leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.